Okay, so now we're going to show you the posterior 204S sickle scaler. So you're going to start by positioning the tip third of on the tooth facing the distal, and you're going to start that distal facial line angle, and you're going to rock into the distal, and you're going to finish right under the contact, just like that. And then you're going to come out and reposition facing towards the mesial, and you're going to come across the facial aspect of the tooth towards the mesial, and then you're going to finish again under the mesial contact. Okay, so I'm going to show you how to use the anterior sickle scaler. I'm going to start at the midline, either mesial or distal, and you're going to have the tip third on the tooth, and you're going to use a rocking and rolling combination stroke, always keeping that third of the tip of the instrument on the tooth, and you want to finish slightly, you want to finish right under the contact, like that. And then you can take it out, and you, again, for the distal, start at the midline, keep that third tip on the tooth, rock and roll, and then end under the contact. Okay, so I'm going to be showing you some common mistakes that early learners make with these instruments. So with the anterior sickle, one of the biggest mistakes, especially on these itty bitty bottom teeth, is having more than the tip of the third on the tooth, or not having the tip third on the tooth at all. So if you start working like this and you don't have that tip third like on the tooth, if you go across like this, you're going to be poking somebody in the gums, and that's going to hurt and bleed and be uncomfortable. So that's one mistake that you want to try and avoid. Another mistake is finishing directly parallel to the tooth, because what this does is that is a really open blade, and again, it's going to cut them in the gums. What you want to do is finish with the blade a little bit closed, like that. So don't be up like this, be down like that, okay? For the posterior, one of the hardest things for people to do is find the working end. So the one rule of thumb is to line it up with the distal, and if the terminal shank goes up and over the tooth, that's the correct end. I'm going to show you the wrong end just so that you can see the difference. This is the wrong end. You don't want it to be wrapped around the tooth. That's not going to get you anywhere. And then once you have that working end, again, when you finish, you want to have the blade closed a little bit. You don't want it to be completely parallel, because you're going to, again, be poking them in the gums. And when you come out to work, you want that tip, just that tip third on the tooth. You don't want to be facing it like this, because again, you're going to go into their gums and it's going to be uncomfortable. And then another thing is just to make your strokes, as even as possible, and you want to be overlapping, because if you don't overlap them, you're going to miss calculus potentially. Same thing on the anteriors, just make sure that you're overlapping your strokes. And then another thing is just your body positioning. When you're in the anteriors, for all the maxillaries, you want to be at 12 o'clock. It's going to be the best way for you to get that fulcrum and that good strong working. Down here, of course, you're going to be switching between 12 and side position, but and then for the posteriors, again, you want to make sure you're in the right position to work, because if you're not going to be, comfortable. So you just always want to remember, where am I? Where's my patient? Light, fulcrum, grasp. You got to think about all of that when you are instrumenting, because it's really important. And I've noticed a lot of you guys are really hunching over like crazy and doing weird stuff like that, and that's just going to hurt you. So you just want to make sure that you have your position good and your patient's position. They can always move. You can move your patient however you need them. Of course, if they have back problems or something like that, you're going to have to work with them. But just ask them to turn their head more, ask them to move their chin up or down. You can adjust them in their chair if they're not quite right. Just make sure you always have your position and your patient's position right.